right, welcome to Live Well with Juniper. I'm your host, Rachel Bremness. Juniper is a program of Trellis and all about optimizing health as we age. We're here to talk about all things wellness and aging in Minnesota. Each week, I'll have guests join me to share wellness expertise, resources, and Juniper behind the scenes info with you. Joining me today is Maren Levad. Maren is the Dementia Friendly Initiatives Program Manager at Trellis, where she leads statewide efforts to make communities more inclusive and supportive for people living with dementia. With a background in equity, focused programming, and community engagement, Maren has spearheaded innovative projects like Dementia Friends Minnesota and specialized training for dental professionals. Her work centers on education, empathy, and creative outreach, from developing dementia-friendly resources for children to organizing arts-based conversations that spark change. Welcome, Maren.
Thank you. I'm so thrilled to be here.
We are so glad to have you. To kick us off, could you please just tell us a little bit about yourself, where you grew up, where you went to school, and what brought you to Trellis?
Yeah, so I have a bit of an unusual path into the aging sector, but I grew up here in Southwest Minneapolis, product of the public schools. Shout out to South High. And then I went East Coast for my undergraduate in film production, and then stayed on the East Coast for my master's in museum education. So the majority of my career before I moved into the aging sector was in the creative arts. So publishing, and then I worked for the International Spy Museum, and then I worked for the National Museum, the National Portrait Gallery, the Smithsonian, and in DC. And then I spent almost 15 years working for the Minnesota Historical Society, doing community outreach with libraries and intergenerational groups around the state. Even getting to travel to Palestine with a group of teenage girls who are doing a historical fashion show. Wonderful. So have had a lot of wonderful experience doing community outreach and engagement. And through that work, I also became the Minnesota Historical Society's first access specialist. So I took on the task of making the 26 sites and museums more accessible for everyone. And as part of that, really focused on dementia-friendly programming for our museums. Okay. And that really, about 10 years ago, got me thrilled and excited to work with this population. I had primarily worked with teens up until that point, and just found working with caregivers and people living with dementia was just a breath of fresh air. It was so fun. Yeah. You were always present and in the moment. And that's really how I slowly merged into this lane.
Oh, that is so interesting and exciting. I'm very curious about that experience at the International Spy Museum. I wonder if one picks up any tricks.
I do. I wrote and ran spy missions with former CIA folks in hotels. We would set up spy missions, and people would pay to, we had actors, and I learned a lot about how to switch your appearance very quickly, and do dead drops and all that sort of thing. And I also learned the personality that works as, a spy. And I don't have it, but it's a pretty impressive personality to have lunch with.
I am sure. And there's talent. Everyone has their own unique talents, and there's power in knowing oneself, right?
Yeah.
And your talents lie in this program creation and engagement and outreach space. And now I know that you are leading an exciting new project at Trellis Care Ecosystem. Can you give us an overview about Care Ecosystem as a program? What is it, and what makes it unique with how it supports people living with dementia and their caregivers?
Yeah, so Care Ecosystem is an evidence-based intervention, which is just a fancy way of saying something that's been tested and shown that it is good and helpful to folks with dementia and their caregivers. And the term Care Ecosystem was created because it really creates an ecosystem for the person who is navigating the healthcare. And when I say healthcare, I mean all the different resources, social supports, education, medication, all of that. It's a lot to navigate when you have dementia or are caring for someone. And so we have care team navigators that work with folks for up to a year, doing telephone-based support where they really address what those immediate needs are, but also know in their back pocket if there's a little bit of space to discuss other things. There are areas that we realize most caregivers or people with dementia would like some support on eventually, whether that be caregiver health and well-being or advanced care planning or long-term planning. And so that's what our care team navigators do. They really work side by side with the caregiver or the person living with dementia to help them navigate the abundance of resources and options to get them the best care and quality of life while living at home.
Absolutely. It's amazing how I think, having been a caregiver myself many years ago, my grandmother was living with dementia. She's since passed, but it's amazing how people can live a lot of their lives not interacting with these systems and resources that exist until something happens, like a diagnosis of dementia, but they don't know where to go because they've never interacted with these resources before. So having someone to guide you that can help with the immediate, but also be thinking in the back of their head, okay, 3 months from now, they might need XYZ. And since they're following up, I would imagine they introduce those additional resources.
That's correct.
As the relationship goes.
Yeah. The way I put it is I have a 15-year-old. So she's a sophomore. She has 3 more years before she heads to college. Yeah. But since about 8th grade, we've been getting information from the schools and from financial planners about, are you thinking about funding? Are you thinking about internships? Are you thinking, people are excited to age during high school and college and to get to that next level. And so you're already looking at what kind of planning and what kind of life you might want. But I find that nobody is planning or thinking about what kind of life they might want with a cognitive impairment as they age. Yeah. And so no one looks at the resources, the funding, like, ooh, maybe I'd want to go to that adult day center, or like, maybe I'd really be interested in dementia friendly, ceramics. You don't think about that until you're in the weeds, in the crisis. Yes. And then it can be really hard to sort through it all.
Yeah. I think overwhelming would be an appropriate word.
Yes.
It's overwhelming to sort through it all. So what inspired Trellis to launch this program, to launch Care Ecosystem?
Well, as you noted, we do a lot of work with dementia-friendly communities. We are really community awareness and educators. So we're out there talking to people in a non-medical setting about dementia. And anytime you give a little bit of information about dementia, like we do with Dementia Friends, we get people coming up and saying, this was wonderful. And then we get people coming up and saying, this is wonderful, but I need so much more. I'm overwhelmed and I can't figure out what to do with my mother. My husband won't get a diagnosis, that sort of thing. And oftentimes in those situations, there are lots of different resources we could send them to. But in the moment, you often need to know, what county do you live in? What healthcare plan are you on? What is your living situation? And there's so much detail you need to know to figure out which resource works for you, that we really felt like it would be great if we could have kind of, for the 7-county metro area, like a one-stop shop where we will connect you to those resources, but we're going to take time to get to know all of that, those answers to those questions, and then get you to those wonderful resources.
Absolutely. And you mentioned something that's really important, is the 7-county metro area. That's the service area for this program. Are there any other eligibility criteria for this program?
Yeah, it's a pretty easy 3 eligibility requirements. The first is that you are a person showing signs of dementia. A formal diagnosis is not required, or you're the primary caregiver for a person living with dementia. The second is that the person living with dementia lives within the 7-county metro area. And the third is that they are still living in a private residence. So whether that's a home, an apartment, an independent living, it just can't be assisted living or memory care.
Sure, that makes sense. And I appreciate that it's diagnosed or undiagnosed with dementia, because I think sometimes it can be difficult to get that diagnosis, just navigating the medical world, or the person living with dementia or other caregivers might not agree about pursuing a diagnosis.
That's correct. And during our year working with them, we will absolutely be educating folks about what are the benefits of receiving a diagnosis. Because there is not a cure, a lot of folks don't think there is a benefit.
Sure.
But the reality is there are over 100 types of dementias, and they have different ways of presenting themselves. And the more we know about your diagnosis, the better we can set you up for success to stay in home. So if you have Lewy body, we're going to be preparing your caregiver for more to potentially hallucinations, paranoia, but there's also drugs that do not do well with a Lewy body diagnosis. And they are often the ones that are the first thing your hospital is going to give you if you're hospitalized. So having that diagnosis is so key. Whereas if you're having frontal temporal diagnosis, the progression of the disease is going to look different than someone with Alzheimer's. And so we really think a diagnosis can be so helpful for that reason, and a myriad of other reasons as well.
Well, and I appreciate you showing those examples, because I could absolutely see how, if you're admitted to the hospital and you are living with Lewy body dementia and you receive medications that work adversely with that diagnosis, how that could completely shift for the negative your hospitalization experience, your discharge, possibly the next few months or years of your care journey.
It's a spiral.
Yes. So yeah. And you blew my mind when you said 100 different types of dementia. I thought there were 4.
There are about 5 that are most commonly diagnosed. Sure. And then there are mixed dementias where, it's like a combo platter, know, so there's lots of different mix and matches.
Yes. But with Care Ecosystem, the navigators are not diagnosing.
No,
they're
just
are not helping to talk about the value of it. Right. So that people understand. Because I understand why people might, at first breath, think, well, why would I do that? There's nothing that can be done to change the fact that I have dementia. But you've convinced me. So I think that's something everyone should be doing. That sounds very, very, like a very important initial step, just to help create some context. So this program launched in late 2025. And so it's just getting going, but there's been a few months now where you've been interacting with clients and caregivers. Have there any common challenges that have come up among the clients up to this point?
Well, I think the 2 most common ones we hear are, number one, I don't think there's any resources for what I need. And then we're able to share that there are literally dozens. We are very lucky in the metro area that we have an abundance of community-based organizations providing really wonderful care, from support groups to respite services in home or in community, memory cafes, education courses, wellness and arts courses. And if we're able to work with you and get to know what you need, we can do the winnowing for you and just send you 1 or 2 that will say, this looks like it fits your need. If it's either your insurance plan or it's free or it's sliding scale, and they have openings. We're not going to send you somewhere that doesn't have openings. And that's a huge part of navigating this world. And so the number one thing we hear is like, we have all these needs. We don't think there are resources because we've never been in this landscape before. And then we really help them connect to that. The other one that we hear early on is, I'm a caregiver or they don't always use the word caregiver, but I'm a person who is caring for someone who does not think they need help.
Yeah.
So I think one of the hardest things when you're caring for someone with a cognitive impairment that has such a high stigma rate as dementia is that people don't see the benefit in saying that they have dementia or getting a diagnosis. And so there's a lot of denial. There's a lot of like, maybe if I just don't look at it in the mirror, I won't see it. And so we have to coach. We have a licensed social worker who specializes in behavioral and family dynamics with dementia, who works with our care navigators to support our families. And this is so key because there are a lot of difficult conversations that you have to have when you are living with dementia or caring for someone with dementia. And we don't get a lot of practice with this in our general adult life, and you really can't ignore it once you have a cognitive impairment. So there's a lot of coaching around how do we have a conversation about diagnosis? How do we talk to the sister in Atlanta who's telling me that she doesn't think anything's wrong with mom, but there is? How do I have that conversation with my husband that he really shouldn't be driving anymore? And oftentimes, how we can let them know they're not the only person on the team. So, if you want a diagnosis, but your husband doesn't, when you are in their my chart to have a regular primary care, you can leave a note saying, please ask my husband about his memory. Or if you don't have access to their my chart, you can slip the nurse a note when they bring you into the room, and they will then pass that to the doctor. They know what that means. So there's lots of different ways that you can enlist other people, friends, family, pastors, religious figures, anyone who has influence in your community's life. You're not the only one who has to have the difficult conversations.
Yes. And having practice with it too is really valuable. And learning some tools for what words to use.
Yeah.
It can be incredibly helpful too. So what kind of impact have you been seeing from the program so far, Maren?
The impact that I am seeing right now is that when we are out tabling at outreach events, we are just hearing, thank goodness there is something. There are lots of caregiver consultant programs and caregiver coaching programs. But the more of us that are out there and sharing the word about them, the more we can connect them to other resources. I think it's just, there's so much noise and there's so little interest in learning about this area until you're in it, that we're just hearing time and time again, their caregivers are just thrilled that there's this support available to them.
Yes. And I know that there's a referral process to access this program. Could you talk us through what that referral process looks like? Can people self-refer? And what can people expect once a referral is received by the Care Ecosystem team?
Yeah, so on our Trellis website in the Dementia Care Navigation section, there is a link to the referral form. It is a very short form. You can self-refer, and then you can, as a healthcare, community-based organization, faith-based organization, neighbor, you can refer someone as long as you have verbal permission that they would be interested in hearing more about the program. Within 2 business days of receiving that online referral, a care navigator will get back to you to talk to you, make sure that you meet the 3 requirements, and then start the intake process. If the online form is restrictive in any way, we also have an email and a phone number on that website that you can contact, and the same will do the referral form with you on the phone. So once you're referred into our program, we actually have 2 levels of care. The first is gateway navigation for folks who might not want or be ready for a full year of support and just might have one immediate need. And we'll work with you on that, 1 or 2 calls to get you to the connection that you need. Otherwise, we enroll you into Care Ecosystem, and we start with that immediate need, and we set up calls. It would be at least once a month we would check in with you, but we can check in with you more often. And you can, of course, reach us directly once you're enrolled as well.
Wonderful. And then after that 1 year, do you kind of offboard people onto other resources?
Within that year, we hope we've built your system of support together so that you feel like you're in a good place. And if you want additional specific caregiver support, like caregiver coaching or consulting, we will hand you off to an organization in your neighborhood that will do that as well.
Wonderful. And I'm realizing one thing that I don't think we've touched on, but people will definitely be wondering is there a cost for this service?
Oh, no, this service is grant funded.
Okay.
So what's great about this program is there's no cost to the consumer, and that is pretty unusual for
Yeah.
care navigation. So we are able to offer this program thanks to a generous federal grant, and we will work with you for a year at no cost.
Oh, that is what a tremendous resource this is. And one of the questions that I like to ask everyone, Maren, since we are wellness focused, and this doesn't need to be dementia specific, of course, but what is one of the best pieces of wellness advice that you've received?
Not to sound like a Gen Zer, but definitely touch grass. And I mean that in the sense of when I first saw the wellness wheel that a lot of college students use or other organizations use, that shows that, it's not that you're well or not well, or you're doing healthy behaviors or not doing healthy behaviors. It's the reality that you are a whole person. And wellness involves community, it involves like learning, it involves nature, movement, food, all of these different things. And you're not going to be knocking it out of the park in every category every day. But, the more that you can ask yourself, are there any areas that I could work towards wellness today? Like, could I go on a walk outside, or could I eat a salad for dinner? Finding that balance. And really the other thing is that finding that balance does not mean that I need to work out for 2 hours or I need to meditate for 2 hours. Sometimes little bursts of wellness are all you need. So sometimes I've been sitting at my desk too long, or I'm in a bad mood. I can dance in my living room to one song and I'm in a better mood already. I can go out and lie in the hammock for 5 minutes looking at the trees and feel better. So little bites of wellness is sometimes really all you need.
Yes, I like that. It makes it achievable.
Yes.
Yes. Well, thank you so much, Maren, for joining us today. How can people get in touch with you to learn more about Care Ecosystem?
So they can visit the Trellis website, and in the Get Help section, you will see the Dementia Care Navigation, where you will find our email, our phone number, and our referral.
Wonderful. We'll be sure to provide all of that in the notes for this episode as well. And thank you again for sharing your expertise today. I think that being a longtime Trellis employee, I think Care Ecosystem is just such a refreshing and exciting new service. And I hope that this podcast helps more people take advantage of this amazing resource opportunity. I'll close this out by saying I'm Rachel Bremness, and you have been listening to Live Well with Juniper. If you like this podcast, please support us with a donation at yourjuniper.org/donate. Be sure to subscribe wherever you listen to podcasts, and don't forget to share with your friends. Until next time, be well.